Don't wait for that feeling of pressure and tightness in the chest to happen to tell you that you might have heart disease. According to the American Heart Association's yearly statistical update, 2024, around 48.6% of U.S. people have some type of heart disease, including coronary heart disease, heart failure, or stroke, with high blood pressure being the most common among them. Shockingly, the same report says that 46.7% of U.S. adults have high blood pressure, yet 38% of those who have high blood pressure don't even know they have it. You might also be surprised to know that according to a survey carried out for the American Heart Association, more than half of U.S. adults don't even know that heart disease is the leading cause of death in the U.S. So the point is that heart disease is more common than you might think, and you might not even know that you have it. So today, we'll tell you about some early signs of heart disease, so that you can recognize these signs of heart problems before it's too late. That way, you can get yourself checked well in time, make necessary changes to your diet and lifestyle, and prevent deadly cardiovascular events like heart attacks and strokes from happening. Let's begin. Number 1. Arrhythmias, or changes in heartbeat. Arrhythmia is basically when you feel like your heart might have skipped a beat, added an extra beat, and sometimes even like your heart may have stopped for a moment and then started beating again. Well, this can happen due to several reasons, most commonly due to caffeine and nicotine and alcohol in people who smoke or drink too much. Even dehydration, exercise, stress, anxiety, sleep disturbances, and an electrolyte imbalance due to changes in potassium, magnesium, and sodium levels can cause arrhythmias, at least temporarily. But if that's not the case, and you're noticing too slow, too fast, or irregular heart rhythms, then contact your healthcare expert, as these might be signs of any underlying heart condition, such as atrial fibrillation, tachycardia, in which heart rate is consistently higher than 100 beats per minute, or bradycardia, in which heart rate is less than 60. Your healthcare expert might run a few tests, like an ECG, and ask you about other signs of heart problems that we'll tell you about as we move forward. Number 2. Shortness of breath. Generally, shortness of breath happens when your body needs more oxygen or there is a shortage of blood. You may feel like you're out of breath when you're exercising, have respiratory conditions like asthma or COPD, are in stress or anxiety, or have a panic attack. During these situations, your body releases a hormone called adrenaline, which causes your liver to break down larger sugar molecules to produce glucose, causing a spike in energy levels. The same can happen when your heart muscles aren't getting enough blood or oxygen, so that spike in adrenaline and glucose levels gives a push to your heart and lungs. So you might notice both a racing heartbeat and shortness of breath at the same time. Moreover, in the case of heart disease, shortness of breath can happen during periods of light activity or resting, especially even when you're lying down or trying to sleep. Common heart conditions closely related to shortness of breath are coronary heart disease, heart failure, and pulmonary edema, in which fluid builds up inside the lungs. All these conditions can be pretty serious if not addressed on time. So don't ignore them. Number 3. Swollen ankles. If you notice that your feet or ankles are swollen or look puffy, your shoes aren't fitting as well as they did before, have difficulty walking, and feel persistent pain in your legs and feet, seek medical attention immediately. These may be the signs of kidney disease or heart failure. Heart failure happens when the muscles in the lower chambers that pump the blood in and out of the heart weaken, causing the fluid to gradually build up in the hands, feet, and ankles. These regions are farthest from the heart and hence more likely to have fluid buildup. And not just ankles and feet, this fluid buildup or edema can also affect the lungs and abdominal region. Remember that edema can also be caused by sitting for prolonged periods, eating a lot of salty foods, kidney disease, lung disease, liver disease, and even thyroid dysfunction. Get yourself checked on priority to find the exact cause and receive appropriate treatment. Number 4. Cold sweats. Sweating is normal when the weather is warm or when you exercise, but cold sweats, particularly when you have them in cold temperatures and while you're resting, might signal something alarming. Generally, cold sweats indicate that your body is reacting to something that's causing trouble, like pain, infection, or stress. The same can happen when your heart is under stress, as it doesn't receive enough oxygen. When that happens, the body releases adrenaline that gives your body an energy spike, makes your heart beat strongly and rapidly, and increases your body's temperature. To cool things down, your body releases sweat. Cold sweats in people with heart problems often happen in the night or when you're lying down. This is mainly because when you lie down, you're kind of compressing the chest cavity, so the heart has to work harder than usual. Besides cold sweats, you might also feel dizziness, nausea, and intense feelings of anxiety, which are like the side effects of stress or hormones that our body releases to control stress, like cortisol and adrenaline. So, keep an eye on them too. Number 5. Fatigue. Feeling tired is normal after exercising, walking upstairs, or doing any physical activity in general. But if you feel tired very quickly, even when doing the simplest tasks or doing nothing at all, it might indicate potential heart problems. Fatigue is more prominent and more common in heart failure and coronary heart disease, mainly because the heart struggles to maintain the blood flow to meet the body's demands. Number 6. Chest pain. Before you jump to the conclusion that you might be having a heart attack, remember that chest pain can happen due to many reasons, so recognizing it correctly is very important. For example, heartburn is a very common condition that often shows up with chest pain. In that case, you might feel a burning sensation behind the chest or breastbone. It usually happens in the center of the chest and can radiate to the throat and mouth, followed by a sour taste in the mouth. On the other hand, chest pain due to heart disease can happen when there's a blockage in the coronary arteries or when heart muscles aren't getting enough oxygen or blood. This may feel like a pressure, tightness, or like something is squeezing your heart from the inside. You may feel it in the center or left side of the chest, and it can radiate to arms, neck, jaw, shoulder, and back. Also, watch out for other signs that we've told you about in this video, like shortness of breath, sweating, dizziness, or palpitations. If that's happening, call 911 and seek immediate medical attention. Remember that chest pain can also happen temporarily, like you may experience it during physical activity or when you're under too much stress, and may go away when you rest. So even when you are noticing it going away, do not ignore these signs of heart problems and get yourself checked as soon as possible. Regardless of which stage of heart disease you are, bringing necessary changes to your diet and lifestyle is crucial to manage heart disease symptoms and take control of your heart health. Here are some of the best tips to help improve your heart health. Number 1. Manage your cholesterol levels. Avoid foods that can increase LDL cholesterol levels, especially vegetable oils that are usually high in saturated fats, such as soybean oil, sunflower oil, palm oil, and others that have been completely hydrogenated or partially hydrogenated. Number 2. Getting healthy fats is equally important as avoiding unhealthy fats. To get more healthy fats, ensure cooking your food in cold-pressed olive oil or avocado oil. Almonds, walnuts, avocados, sesame seeds, and fatty fish are rich in healthy fats too. Number 3. Exercise regularly, as it is one of the most effective ways to lower cholesterol and triglycerides, manage blood sugar, reduce inflammation, improve the flexibility of your blood vessels and heart muscles, and shed those extra pounds from belly fat. Choose exercises depending on the severity of your heart condition. Aim for 150 minutes of moderate-intensity aerobic exercises per week, and if you can't do that, take at least a 10 to 15-minute walk daily, especially after having a meal. Number 4. Keep yourself hydrated. You'll be surprised to see how effective it is. Water keeps your blood diluted, reducing the strain on your heart as it pumps the blood. It also helps your kidneys flush out extra minerals from the body, especially sodium, preventing edema. Staying hydrated becomes even more important if you're taking medications for blood pressure control or edema, like diuretics. Number 5. Keep an eye on your overall sugar and refined carb intake. Both these things cannot just increase your blood sugar, but can also increase triglyceride levels in your blood, which are tiny fat particles that can clog your arteries. Number 6. Limit foods and drinks that contain sodium or table salt, especially processed meats and processed snacks. Get enough potassium and magnesium from foods and supplements if your doctor tells you to. Number 7. Lastly, manage stress. Get enough sleep, quit smoking, and quit drinking. Check out these videos too.